Wards 10 and 11 are where we treat all cancer and blood disorder patients. The patients that we treat come in for chemotherapy, blood transfusions and other types of treatments, and often spend large amounts of their life whilst they're being treated in with us on our unit. We provide a very high standard of care, but currently the environment in which the patients receive their treatment is quite cramped, quite old-fashioned, very lacking in privacy, and therefore the sort of privacy and dignity for these sort of patients is really quite below the standard that it should be.
This is our chemo end, where all the people that are having chemotherapy get treated, which as you can see is quite small. We can have up to 6 patients being treated in here at any one time, so it does get quite busy. There is a corner over there which is a pre-chemo corner. Patients are getting asked all sorts of questions while they're sat there about their toxicities and things, so fertility, nausea, vomiting, hair loss, all that sort of thing that they don't necessarily want other people to be listening to, but haven't really got a lot of choice. And if people become unwell while they're having their treatment, if they did start feeling sick or being sick at all, there's nothing we can do except pull the curtains around, which again offers no privacy because everyone can hear exactly what's going on. This is the second doctor's consulting room, which used to be our tea room, but obviously we needed more space for the doctors, so it got made into a doctor's room. So we now don't have our own tea room. We share with the pathology lab, which means as nurses we don't have anywhere to go to sort of offload with each other, because obviously there's lots of other people in there, so you can't go and talk about some of the issues that you might want to, with risk of other people listening. This is the second waiting area we've got on the ward, which you can see is far from ideal. It's just a row of chairs and it faces the toilets. You'll find that there'll be people stood all around the corridor waiting, which isn't ideal. There's not enough space, so we end up with patients stood all around here as well.